Welcome to another episode of the Dental Insiders with your hosts, Matthew Petchel and Michael Dunn. The Dental Insiders is a podcast for dentists, dental team members, and industry professionals. We share stories and lessons from clinicians and industry visionaries with the goal of providing an entertaining and informative look at the industry we share. And our guest today is Dr. Jacque Russo, founding member and board member of the American Academy of Oral Systemic Health. Thanks for joining us, Dr. Russo.
Oh, it's definitely my pleasure. Thanks, guys, for having me.
So first off, we pronounce it AAOSH. What do we? How do we?
It is. It's AAOSH. It's an acronym, obviously.
Yeah.
And back in 2010, there were 34 of us that got together in Madison, Wisconsin. Chris Kammer was our guru. He's the grand poobah of AAOSH. And there were just a group of us that were very interested in this whole issue about periodontal disease and all these different therapies and everybody doing something different trying to treat it, and really none of us being very successful. Right. Because the standard of care is you shouldn't have bleeding gums, but every single one of our patients had bleeding gums. So we got together and tried to figure out how can we collaboratively, easy for me to say, work together and create some solutions that really will help our patients' overall health.
Well, let me ask this: why did it take so long? And this is not, I'm not saying it's your, you've saved it. You've kind of created something, but why 2010? Seems like this should have happened 30 years ago, 50 years ago.
Yeah, a long time to realize
Well, that's a great point. And I got to tell you, there were some leaders that have been talking about overall whole body health for probably 50 years, Weston Price and a few others. But the problem is it's never been mainstream. As medicine has evolved, we become more specialized. So you go to a cardiologist and he talks to you about your heart and your vessels. You go to a dentist, they talk about your teeth and your mouth. But we've kind of missed this connection that we're all one body and the blood flows throughout the body. And, eyes are not just eyes. They're part of our whole body, and we can no longer compartmentalize medicine. And so I think hopefully we're finally now seeing that shift back to holistic medicine, and that's our goal.
So is this only a dental organization, or are there other practitioners involved?
Oh, it's definitely not just a dental organization. It was started primarily by dentists and hygienists. But our key opinion leaders now include physicians, nurses, dietitians, nutritionists, holistic healers from all realms. And it's really important that we outreach to those communities because, again, it's not just mainstream dentistry or even mainstream medicine. It's about holistic body health.
So that was 2010. You said there was a band of 34 of you that got together and said, okay, we need to take this bull by the horns. Okay, right. So what's going on now? How has it changed? What's new?
Well, we're going to have our 6th scientific session. This year will be in Orlando in September. Please come join us. And what we've done is we really have started making some inroads into, well, first of all, the scientific literature has been evolving, and it is irrefutable now that what goes on in the mouth affects the body, and what goes on in the body affects the mouth, and we can no longer separate them. So we're seeing, our programming. If I look at, let's just look at, for instance, what we've got going on in Orlando. We've got some old names in dentistry with Sam Lowe and Lisa Marie Samaha, which are a couple of key opinion leaders in dentistry that are all about periodontal disease and inflammation. But we've also got physicians, we've got PhDs talking about gene expression and the aging process, cancer screening for the special needs patients, nutritional counseling, inflammatory diets. So, I think we've just we're crossing over, and it is much more directed to evidence-based science, but total body wellness.
So you said September in Orlando. What are the dates?
It's the 16th and 17th at the Gaylord Palms. And if you go to our website, www.aaosh.org, you can see how to sign up, register, and gosh, we hope you'll join us.
AAOSH.org? AAOSH.org. Register for the meeting in September.
We're going.
We're going to go.
Awesome. Awesome. I hope so.
I'm going to switch gears here for a minute.
Let's do it.
Let's switch gears. So we've talked a little bit about AAOSH. I think we're going to come back to AAOSH, but we jumped right into it. We didn't talk about your story.
Let's talk about you.
Let's talk about Jacque.
Well, that's not near as exciting as AAOSH to me, but maybe because I've lived with myself a long time. But well, I started out as a nurse. I went to nursing school and I practiced nursing for a few years in critical care areas. And then I decided that I wanted to have my own small business and went back to dental school. And I practiced dentistry for 15 years. I was just starting to, I had all my debt paid off and was getting really good at what I do. And then I got arthritis, guess where? In both of my thumbs. That was like, really? And so it kind of, took the wind out of my sail. I really wasn't sure what I was going to do as my third career. But it took me on a whole new path in my life, as so many things like that do, right? And I started, well, first of all, I started going to regular mainstream medical practitioners to try to figure out why at 44 years old, I got arthritis, disabling arthritis, and realized very quickly that their solutions to my inflammatory disease was pharmaceutical, and that was all they could really do for me. It was one drug after the next, and I got sicker and sicker and sicker. And finally, on my 50th birthday, I was like, I almost couldn't get out of bed. I was depressed and fatigued and in so much pain. I was feeling pretty hopeless. And it just so happens that, God sends a messenger when you're ready to hear. And I ended up in front of a nutritionist and did some testing and found out that, it was really my diet and my lifestyle that wasn't supporting my immune system and my own body being able to heal me. So fast forward to today, the last 8 years of my life have been dedicated to researching more natural, holistic, nutritional, scientific approaches to healing our own body, and more importantly, preventing these kind of autoimmune inflammatory illnesses in the first place, which ties in perfectly with dentistry because periodontal disease is an inflammatory disease. And it's the most common inflammatory disease in our body.
Right.
So if we have inflammation in our mouth, guess what? We have it everywhere. And as dentists, we get to, be the front line really to help diagnose these kind of diseases, which, they show in the body as all kind of systemic symptoms. And for me, it was arthritis. So had a little bit of a, few diversions in my journey.
Well, and they say that the eyes are the gateway to the soul.
They
the
do
mouth,
say that.
Some people do.
One
no,
person.
you're right.
I know.
I know. I read it somewhere.
Okay.
No,
And
I
it must
have
be true. But the mouth is the gateway
to the body.
To overall health.
Absolutely.
And,
It's the beginning of the digestive tract. And so, and we are really one big tube from the mouth to where.
Right.
Yep.
That's what we are.
Well, and it's funny because, or not funny, haha, but it's funny. As children, a lot of us are told, things like you are what you eat. And so we're given this message as youngsters that, okay, your diet and your what you put in your mouth is related to your overall health, and of course drink your milk, strong bones and muscles and all that.
Right.
But then
even if you're allergic to milk, drink milk,
exactly,
right? That's kind of the one size fits all thing.
Right. But then we have, this now we're in a profession that is about healthcare, dentistry, and we have this large swath of the professional community that just kind of ignores that whole fact about the connection between overall health and dental health, and the fact that periodontal disease and other inflammations are reflections of what's going on in the rest of our body. So I just think that it's crazy to me, I guess.
Well, unfortunately in the medical landscape today, prevention is not profitable. It's just not. I mean, you doctors can't code. There's no code for that. There's no way for them to build for that. So when they've got 5 minutes to see you, they want to know what your symptoms are so they know what drug to recommend for you to take to the pharmacy and get filled. There's nothing about what's your diet. They weigh you, but they never even mention your weight, your BMI, the fact that you're obese and that's causing inflammation and, all kinds of other problems. they just don't go there because they don't have time and it's not profitable. So one of AAOSH's main missions is to make profitable preventive health care the new norm in 2020. And boy, do we have our hands full. But, one year we were at the Cleveland Clinic and Mike Roizen was our keynote speaker. And he said, if we don't get this healthcare crisis under control, it's going to bankrupt our country. I mean, our existence as United States of America, as a free country, he said, is literally at risk. And I just think that dentists can be a key major player in this paradigm shift, towards prevention and health. We already have a preventive model in our practice.
Right.
With our hygiene appointments. And so our hygienists, man, they are the warriors. They are really, truly our Marines when it comes to getting that message out.
Yeah, and that's, you mentioned the word paradigm shift, and in our experience, and I'd be interested for your insight, is dentistry and paradigm shift generally don't collide. They just kind of are.
It's like a paradigm iceberg moving.
It's just, we're all humans, right? So we all suffer sometimes from habit, kind of go with what you know and stick with what you're good at. But when the science is so clear, right? And we're talking about people's health. We're not talking about your preference on something, that doesn't really matter. This is a bigger deal. So how else are you getting the word out? Because the word is, it's clear. I think anyone who reads it, it's like one of those things, once you research it and see it, how do you do it? How do you communicate that?
Well, with AAOSH, we're going from a ground up approach, and that is educating the public. And then we're doing a top-down approach as well and trying to educate the healthcare professionals. But what's happening, I think, probably because of the internet, is our patients, our clients, the consumer is getting more educated. They don't want to go to the doctor and get a prescription. They want to get well without medicine. And I think one of the biggest growth industries right now is the wellness industry. So, for doctors, dentists, all healthcare professionals who are bemoaning, the ever-shrinking dollar, the loss of discretionary income by their patients, you know what? You need to get ahead of this trend, this wellness trend. You need to get on board. And if for no other reason, it's for profits. I mean, if you don't want to be eaten up by corporate dentistry because you can't afford to pay your employees, yourself, whatever, then you know what? Get in front of this trend that people are willing to pay for.
Right. So that actually is a great segue into my question for you. You talk about this wellness trend, and you've been a nurse, you've been a dentist. So, if you were talking to a dental student or a young dentist or a dental hygiene student, and you're talking about this wellness trend, what advice would you give them? How do they get in front of this trend?
Well, okay. So the first thing that I think these, kids today going to school have to do is they've just got to try to minimize the amount of debt load they take on when they go to school, because it was bad when I was in school. I graduated with a couple $100,000 worth of debt. And they're talking today that dentists get out of school owing $500,000. And one of my other companies is a dental office design company, and we, try to help dentists get financing and help them design, ergonomic, healthy, beautiful dental offices. Well, half of our dental offices don't get financed because the dentist has so much debt already. So, long story, my point is, try to minimize the amount of debt you come out of school with. That's so important, because it just puts you in a really bad place when you go out and try to start your business. But if you are a good business person, you look at the demographics, not just who lives in your neighborhood, but what is the group of the group of people with discretionary income, and what are they spending it on? And it's still about the baby boomers. I mean, the millennials and all those are coming up closely, but the baby boomers are spending their money on feeling younger, looking younger, and that that includes their teeth looking better, their whole body looking better, them feeling better. And so it's just a natural fit in dentistry to get involved in the wellness thing, because, everything, like you said, is about what you eat, what you absorb, how healthy you are, the lifestyles you live. And dentistry offers a perfect platform to be a health coach in those arenas, I think.
Yeah. Jackie, you mentioned a word, and I think we're going to have to do another episode on this topic, ergonomics.
Yeah.
Because dentistry, I think, we often forget that in a way, it can be a contact sport, but, from neck pain, lower back pain, sure. Dealing.
Isn't that crazy? Why do we practice dentistry like this?
Yeah.
Every other surgeon uses microscopes and big monitors. There's no reason for us to practice dentistry the way they do.
Right. Posture is such a big issue in dental practices.
Right.
I think that deserves its own episode.
It probably does.
It probably does.
Yeah.
It probably does.
I think so. So, I think we're coming close to our time.
I was going to say one thing.
Yeah.
You were going to try to end this. I'm not going to let you end it.
I had one more question.
Say
I wasn't trying to answer.
All right, I'll
ask it. End
well, what I want to say is, how do we help? And you're doing it, but how do we continue to help make the role of the hygienist more valuable? Because maybe there's a world where the hygienist is the first person you see, and then maybe you need to go to the dentist. Did I just create a business model that probably doesn't work?
As far as, well, no. But yeah, I think that's a great question.
Well, you're really smart, Matthew, but you're not the first person to ever come up with that idea. In fact, in many states, hygienists are trying to start their own businesses for that exact reason.
Right.
The American Dental Association, a lot of lobbyists and political organizations are against that. It'd be kind of like letting a nurse open her own practice, and if you need to see a doctor, she refers. So, there's both sides to that argument, making it more affordable and more accessible by having hygiene clinics where you could go. But the bottom line is we do need to empower, enlarge, and make our hygienists a bigger part of our dental practice. They are the front line. They are the ones who have the deepest relationships with our patients. They spend the most time with our patients.
Right.
I think, my message to dentists today is give her all the power, pay her what she's worth, pay her on commission for what she's able to provide to that patient, pay her on successful treatment of that periodontal disease. If the whole healthcare system paid that way, if your doctor had to get you well in order to get paid, or would get paid more if he got you well, then maybe we wouldn't just be managing disease. Maybe we would actually be trying to prevent disease and actually cure the root cause of the disease and not just put a Band-Aid on the symptoms.
Maybe we should make her a partner. Maybe. Dentist. So right now all the dentists are like,
yeah, right.
But all the hygienists like
that's a great idea. Well, but maybe that's the there's something to it.
There's something to it, and there's something to the model evolving and the need for the model to evolve to some degree. We started out this interview, this conversation, talking about AAOSH and the AAOSH meeting in September, AAOSH.org. I think I've answered my next question, but okay, the dentist or hygienist out there is interested in getting involved in AAOSH. How do they get involved?
Pretty simple. Go to the website. You can sign up as you can join as a member. That doesn't mean you have to go to the scientific session, although boy, that is where the rubber hits the road. But even by becoming a member, you can get 12 hours of CE free every year just by doing our member webinars. And there are some excellent programs by some really top key opinion leaders in our industry. So that's a great benefit. Plus you get on our member directory, and believe me, patients are starting to search for AAOSH trained dentists, just like when the American Academy for Cosmetic Dentistry started out. Remember that was kind of a big trend for 20 or 30 years. And oddly enough, or uniquely enough, Chris Kammer's father, Jacque Kammer, was the innovator who started that organization, and now his son Chris is carrying on with the next trend, what I believe the next trend in dentistry, and that's going to be oral systemic health. So yeah, they can go on the website and become a member and start taking advantage of some of these benefits right away, and then join us in Orlando.
Awesome. Well, I think that might wrap it up that
went fast, guys.
As we coined the phrase, the mouth is the gateway to, and I think we have to fill in the oral total body health
or something like that.
It needs a good snap.
Yeah, we're trying to reunite the mouth with the rest of the body, guys. That's the bottom line.
You got it. Well, we'd like to thank our guest, Jacque Russo, for joining us and spending the time with us. We really enjoyed it. And thank you, our listeners, for listening to another episode of the Dental Insiders podcast. Please tell your colleagues and friends. Thanks, Jacque.
See you on the flip side. Bye, guys.
Bye.